Hi guys, this is Dr. Adams again, chiropractic physician at Miami Spine and Performance. We wanted to add a second part to the last video I did when I talked about some of the common mechanisms of neck injuries, sort of the biomechanics of the neck, and I went through a couple of different stability and mobility options for you, whether you're warming up to get on the mats or whether it's an off day and you're just doing some training and some maintenance on your body to keep yourself healthy when you are on the mats training jiu-jitsu. So I wanted to give you guys more of a structured routine that you can use. Again, this would probably be most appropriate before jumping on the mat, so maybe something you do at home or something you do before class. Or again, a lot of these things can be done on a daily basis. If you really want to improve your neck function and you really want to stay ahead of any injuries, I always encourage people that, you can't overdo it. Doing it once a day is a great cadence for these types of things. So the first one that I want to start with is the chin retraction, okay? And again, you're going to do this from a seated position. And being in a chair is a little bit better so that you don't push your entire torso back, but this will do. And you're gonna push. Again, you're doing the chin retraction, so you wanna feel a little pull, a little stretch in the back of your head, and then you're making the double chin. I'm using the 2 fingers for extra pressure, okay? You're gonna start by doing just 20 of those. You can break it up into 2 sets of 10 if you'd like. We're gonna do 20 chin retractions just to warm up the neck. And then we're gonna go right into the next movement, which is gonna be retraction with extension, okay? So we're gonna do our chin retraction and then extend the head back. Again, retract, hold the retraction, and then let it go and extend. The reason why we do the retraction before the extension is if, let's say I'm somebody and I have a little bit of a forward head posture like this and then I go to extend, I'm going to be pinching off my neck a little bit. So the retraction presets you into a good position to hit the extension. And again, you're going to retract into the extension, but you're not going to hold the retraction. Obviously, if you come back like this and you try to hold the retraction, you're just going to end up kind of with some stiffness there. So once you're fully retracted, you let the chin go. And again, you can use 2 fingers. Give yourself a push. We're trying to extend. If you put your hand on your back, you'll feel a little lump between your neck and upper back. We want to extend over that lump. So we don't want to be extending through our mid-cervical spine or the middle of our neck. We want to make sure that we're moving our entire neck over our upper back. So again, we've got 20 retractions. Then we're going to go in and we're going to do 20 retraction extensions. And again, this is really just to get the neck warmed up for our main exercise, which is going to be our developmental positions here on the table. So like I talked about before, this is the 3-month prone position. It's the position that infants, when they start to lift their head up, will get into. We're going to position our elbows in line with our ears. Our hands are going to be up, so we're not going to be grabbing the table. I'm going to push my elbows in and lift my chin up. And what I want you guys to do here is you're going to do 2 sets of 10 with a 3-second hold at the top. Now during your second set of 10, you can go ahead and look up a little bit and make it a bit more of a upper back and lower neck exercise versus the chin retraction. So this is going to work more of the extensibility of the cervicothoracic junction where the neck and the upper back meet, whereas this variation, we're going to be working more neck stability. Okay, so again, we're doing 1 set of 10 straight retraction from this position, 1 set of 10 with the extension. The next thing that we're going to do is we're going to go up into our position here. We're propped up. We're not looking all the way up, or we're just looking up slightly. We're going to do our rotations. Look all the way over each shoulder. And for this one, I want you guys to do 2 sets, 10 repetitions each side. So once you've done 10 on each side, you're going to rest. You can hang out in this position if you'd like. Take about 30 or 45 seconds off. Go back in. Another set of 10, rotating each side. After doing 2 sets of 10 of the rotation, I want you to do 1 set of 5 repetitions each side of the full cervical controlled articular rotation from here. So again, this is going to be and then we'll switch directions. So again, the cervical controlled articular rotation, we're going to make a full circle with our neck, including flexion, extension, rotation, and lateral flexion, but we're going to do it from this developmental position. And as you go through this, you're going to start to feel your shoulder blades working. You might even feel your ribs, that's your serratus anterior working. We're going to do the cars from that position. 5 repetitions each side for 1 set. The final exercise we're going to do is from the 4.5-month position. So again, one leg's going to crawl up. So then we're going to have contralateral stability from our left elbow to our right hip. And we're going to do arm reaches. We'll do 10 arm reaches and 10 openers. So this is more for building thoracic rotation, but we're also stabilizing our neck throughout that movement. Again, I'll switch sides. We're going to go through here and do our swimmers. 10 repetitions here, moving the arm, keeping the neck nice and stable. And then we'll look up and out. Remember, when you drive yourself up, you're pushing through your right elbow, your left knee. Turning and rotating. All right, guys, so just to recap, you're going to do 1 set of 20 chin retractions. You're going to do 1 set of 20 retraction with extension. You're going to do 1 set of 10 retracting the chin from the 3-month position. 1 set of 10 extending from the 3-month position. You're going to do 2 sets of 10 rotating from that position. You're going to do 1 set of 5 full controlled articular rotations each side. And if you're doing it properly, it should take you 5 or 6 seconds to go all the way around. I was going a little quick just to make not to make the video too long. But you want that controlled articular rotation to be very slow, very deliberate. And again, you're going to do it from that position. Then you're going to bring up your opposite knee. You're going to take the arm off. You're going to do the swimmers, 10 repetitions, and then you're going to do the thoracic rotation, where we're working on rotating through the upper back as well as moving the shoulder blade. Again, we're doing all this off the foundation of a stable neck. So we're maintaining a little bit of a chin retraction, and then we're going to switch sides. We're going to do 10 swimmers on the opposite side, 10 rotations on the opposite side. Again, guys, give that one a try. You should be able to get through it in 10 to 15 minutes. So if you are somebody that has neck injuries, or you know you're going to have some hard training that day, go ahead and run through this warm-up. Not only is it going to help strengthen your neck over time and build mobility, as you can see, we're also working on the upper back. We're working on activating the small muscles of the neck, working on activating muscles of the shoulder blade, in order to ultimately inhibit muscles like the trapezius and the lat, muscles that tend to get tight and restrict your ability to be effective with your upper body on the mats. So give it a try and let us know what you think, guys. Thanks.